Hello and welcome to Midlife Moments with Dr. G. I'm Dr. Georgina Hale, specialist medical doctor and PhD in midlife women's hormones. Here I am in beautiful Marina del Rey in Los Angeles, and I'm going to talk to you about estrogen and whether you should have your estrogen levels checked. So if you have regular menstrual cycles, whether you're in midlife or you're moving into the perimenopause, you don't really need your estrogen levels checked. The chances are that you are actually ovulating if you have regular menstrual periods. I'd say there's a more than 90% chance if you've got regular menstrual periods that you're ovulating. Now, if you're ovulating, your estrogen levels don't need to be checked. Now, if you're a lady whose doctor suspects that you may be having anovulatory or non-ovulation cycles, sure, you can have that tested. But remember, to test for ovulation, you have to test during the luteal phase. So I'm just going to put up this graph again. I put it up before. Now, the estrogen is in black. So the estrogen goes up during the first part of the cycle, comes down from the peak about a third to a half during the mid-cycle, and then rises and falls again during the luteal phase. And you can see that in the pink is progesterone, and it is steady state low during the first part of the cycle, the follicular phase, that's the green, and then rises and falls during the luteal phase, that's the yellow. So if you're needing to work out whether you're ovulating, remember it's the blood test for the hormone needs to be taken in the luteal phase. Now, for my instructions, if you've got a 25 to 35 day cycle, you aim to take the blood test on day 19 to 23 of your menstrual cycle to catch that rise in progesterone. Now, remember that, just random testing, you can see it's very variable, the levels of hormones. It's also very variable between women. So you can see, for example, in your follicular phase, a normal estrogen level can be anywhere from 70 to 530. That's in the Australian sort of guidelines for picomoles per litre. For the follicular phase, luteal phase, it's anywhere from 200 to about 800. So you're in the normal range even when you've got such variation. In mid-cycle, the peak can be often even as high as 1200. Okay, so measuring just once off and even trying to get the middle of your luteal phase, it's always a guesstimate as to where you're getting the blood test measured. And I've often had some doctors say, oh, well, their progesterone was low. And I say, well, what do you mean? How do you know it was low? Well, and they only measured one time during the luteal phase, but they don't know when in the luteal phase it was in relation to the peak of progesterone. Was it just on the upward swing or was it on the downward swing? So if it was lower than what they'd expect a peak to be, well, you can't really say it was low because you don't know what was happening during the rest of the luteal phase. It's the same with estrogen. Now, a lot of people know about urine testing. Now, I don't request urine testing in midlife and early perimenopause or even late perimenopause because the levels are so variable. The urine testing is usually done several samples during a single 24-hour period. So I don't know when in your menstrual cycle or whether you're having spurious estrogen, comes right down again, goes normal. It could be anything, so I don't use an expensive test like the dried urine testing, generally in midlife and perimenopause. Some people are very interested and they don't mind spending the money, and they might do several tests throughout the whole menstrual cycle, and that's called cycle mapping. And yes, that can be helpful in some circumstances. I guess also in some women who are not ovulating very well or have a poor luteal phase progesterone level. That's getting into sort of specialty areas. So most of the time I don't use the urine testing for midlife and perimenopause, but where I do use it, infrequently, but where I do use it is when I'm giving a menopausal patient hormones, because I want to know how their body is handling the hormones that I'm giving them. And in the case of estrogen, I'm more likely to give a menopausal woman a patch, less likely a gel or a cream, and less likely, again, oral tablets, just because of the safety profile. Of course, I will use all of them, all four, and give a patient a choice depending on their circumstances and how they've responded to the patches versus the gels versus the creams. And what I'm looking for is the metabolites of estrogen, how they're handling the metabolites, how they're detoxifying from those metabolites, the methylation strength, which is very important in detoxification of estrogens, and clearing the kind of estrogens that are byproducts or breakdown products, which can be, let's say, more likely to cause estrogen-related cancers, for example. The urine testing also gives information on oxidative stress, progesterone, androgen levels, and melatonin. So I find in menopause it can be a very helpful test, but certainly not needed in terms of management. So as far as you needing estrogen levels done across the board, not really. Another time I might ask ladies to do, or women to do, estrogen levels if I'm suspecting they've actually got very high estrogen levels. Okay, so excess estrogen symptoms, very heavy menstrual bleeding, headaches, and other symptoms like bloating, for example, and a lot of midriff weight. So again, I would always take the blood sample during the mid-luteal phase. So again, cycle day 19 to 23, or around about there, when you're still having regular periods. It's very difficult if you're having spaced out short, long cycles and you can't predict when their luteal phase is going to be. So you might have to have a crack at it several times to get a luteal phase level. Interestingly, if I do suspect excess estrogen because they've got excess estrogen symptoms, I will find a high estrogen level during the luteal phase, sometimes 2 or 3 times the upper limit of normal. Now that's very useful to know, because you can convey to the patient, to the woman who's got the symptoms, this is why you're feeling these symptoms. There's not much we're going to do about it, because you'd have to take something like the oral contraceptive pill to abolish all those ups and downs in estrogen occurring with the ovulatory cycles, and the excess estrogen which is occurring because of the stage of perimenopause that people are in. And that's kind of what my PhD was explaining why people can get very high peaks of estrogen, up to 1,500, 2,000 picomoles per litre. That's roughly 2 1/3 times less for the units that are used in America and some parts of Europe. Anyway, I hope that was helpful, and next time I'll talk more about progesterone and estrogen testing, and when you would like, when it is indicated or when it is not indicated. See you next time.